Hey, welcome back. I'm so glad you came for episode 2 of Before You Go Under the Knife. If you haven't listened to episode 1 yet, go back and start from there. We laid a lot of groundwork about how the cosmetic surgery industry got to where it is, and it'll make everything we talk about today make a little more sense. But if you're here and you're ready, let's go. Because today we're going somewhere most podcasts won't take you. Today, we are talking about what actually happens to your body, the procedures, the real risks, and specifically what goes wrong when it goes wrong and why. Now, I do know that sounds like I'm about to scare you. And I want to address that directly. I am not here to scare you out of surgery. I believe in your right to get your body done, girl. Go for it. What I am here to do is give you what I believe is the most important thing that you can walk into a surgical experience with. And that is information, real information, the kind that nobody reads to you from the consent form. I spent years in plastic surgery offices. I know what these procedures involve. I know what the risks are. And I know, because I've seen it, what happens when those risks aren't properly managed. So let's talk about it like friends, because it is what it is. Let's start with the BBL and why it's different from everything else. The BBL, the Brazilian butt lift, let's get into it because I think there's a lot of information out there and a lot of misinformation. And I want to give you the clearest, most honest version of what this procedure involves and why it carries the risks that it does. Here's what a BBL actually is. Mechanically, liposuction is used to remove fat from your abdomen, your flanks, your back, your arms, your inner thigh, wherever it is that you're getting your donor fat from. That fat is then purified and re injected into your buttocks to create the shape and volume that you're looking for. That's the procedure, and it's really relatively straightforward. And when it's done correctly by a properly trained surgeon in a properly equipped facility, it can be a transformative result. Beautiful results. Here's the risk that the American Society of Plastic Surgeons has identified as the reason the BBL carries a higher mortality rate of up to 1 in 3,000. 1 in 3,000. For context, that's higher than virtually any other elective cosmetic procedure. For BBLs, how do people die during a BBL? That's the question, right? The mechanism of death is this. If fat is injected too deeply into the gluteal muscles rather than the subcutaneous layer, which is that fat layer just beneath the skin, it can enter the venous system, the veins. And once fat enters the bloodstream, it can travel to the lungs and cause what's called a pulmonary fat embolism. The fat blocks the blood flow to the lungs and heart. Death can happen within minutes. This is not a freak occurrence. This is a known, documented, and understood risk. The medical community knows exactly how it happens. They have issued specific guidelines to prevent it, inject superficially, use ultrasound guidance, never penetrate that deep muscle layer, and yet it still keeps happening. I want to tell you about 3 cases, all anonymous because together they show you something important. I'm not going to knock anybody down. Case 1. A board certified surgeon at a strip mall clinic in Florida. He uses ultrasound guidance during procedure, which is a safety tool specifically designed to help a surgeon avoid injecting into the deep muscle layer. He uses it and he still injects into the deep muscle layer. The patient dies the following day. Her autopsy confirms fat deposits in her lungs, her bloodstream, and her deep gluteal muscles. He was board certified, He had the safety equipment, and yet she still died. Case 2. A 29-year-old woman, a mother of two, she gave birth to her second baby 2 months before her surgery. She found the clinic online because the price was affordable. Her friends said later that her last words before going in were asking her to pray for her. She died from a fat embolism during the procedure. The state complaint, filed 2 years later, alleged that the surgeon had not done a proper physical exam and had not flagged that she was only 2 months postpartum. The minimum safe wait after giving birth is at least 3 months. 2 months, 8 weeks. That detail, that one clinical detail, might have saved her life. Case 3. A mother of 5 from Nashville, Tennessee. She traveled to Miami for her procedure. Her surgeon had started his procedures at 6:32 in the morning. By the time he reached her, it was 8:31 at night. She was his 7th patient of the day. He had been operating for 14 hours. During her BBL, he perforated her liver, her bladder, and her intestines with the surgical cannula. She died approximately 2 hours after the procedure began. 7 patients in one day, 7 surgeries in one day, 14 hours on your feet, and she was his 7th patient. Now, I want to say something very clearly. The BBL is not an undoable procedure. There are very skilled surgeons performing it safely every single day. I know that. But the margin for error is very, very thin, thinner than almost any procedure out there. The difference between a safe BBL and a fatal one can literally be an inch apart, a centimeter of depth. This is not a procedure you choose a surgeon for based on price. Let's talk about liposuction because I think this is the procedure that gets the most underestimated in terms of risk. And I've seen that misconception up close and personal for a very long time. It's just liposuction. Patients come in thinking it's a easy in and out. I'll pop in, get a little lipo, be back to work on Thursday. And I get it. That's how it's marketed in a lot of places. Your recovery, you'll be back to normal within a week. There's even lunchtime lipo. Come in, we'll do your lipo, you'll get back to normal in the next 24 to 48 hours. And when liposuction is done correctly by a properly trained surgeon in a properly equipped facility on a properly screened patient, it can genuinely have a really straightforward recovery. But here's what often is left out: liposuction is still surgery, real surgery, and it carries real risks. Fat embolism, a lidocaine toxicity, which is when local anesthetic reaches a dangerous level in the bloodstream, organ perforation, fluid imbalance, infection, anesthesia complications. These are all real risks when you have surgery. They're not rare, theoretical risks. These are things I've seen happen. These are documented in cases across the country. Let me give you a few examples. Again, anonymously, because the pattern matters more than the names. A woman goes in for a tummy tuck and liposuction at a chain clinic. A sales agent told her that she was a perfect candidate and encouraged her to book that day without going home to think about it. The surgeon who operated on her was an ObGyn, not a plastic surgeon. Days after her surgery, she wakes up with fluid leaking from an open wound in her stomach. She spends a week in the hospital with a severe infection. She describes it later by saying she felt like she had been skinned alive. More than a year later, the scars remained. Another case, a surgery that ran for 10 hours. 10 hours of liposuction at an outpatient center. The clinic removed 6,600 cc's of aspirate, a significant amount. The nurse's documentation suggested blood loss of around 2,200 cubic centimeters. The surgeon's operative note recorded 300 cubic centimeters of blood loss. There was no blood available at the clinic for a transfusion, but the consent form had mentioned that transfusions might be needed. There was no blood. The woman died of hemorrhagic shock. And then there's this case that I think about when I think about why I do this work. A woman undergoes liposuction. During the procedure, she begins to scream. She's saying, it's tearing, it's burning. A staff member stuffs a towel in her mouth, so the people in the waiting room, including her fiance, cannot hear her. She died on the table. The medical examiner found a perforated diaphragm, multiple puncture wounds to her liver. 4 months later, a second patient died at that same clinic. The surgeon in that case was an ER doctor, not a plastic surgeon, not board certified in surgery. She opened a cosmetic practice because the law allowed her to. Now let's talk about the makeover packages. When more becomes too much. This segment is one I feel very personal about because I watched this happen from the inside in the consultation rooms, and I wanted to be honest with you on what I saw. The makeover package, the mommy makeover, the fuel transformation, book everything at once, recover once, come out on the other side completely changed. I understand the appeal. I help my clients with mommy makeover transformations every day, and I understand the mommy makeover. One recovery period instead of multiple, significant savings compared to scheduling procedures separately. You go in as one version of yourself and you come out as the version you've been working towards. And here is what I need you to understand about the medical reality of combining multiple procedures. Every hour of additional surgery increases the risks. Anesthesia time accumulates. Blood loss accumulates. Your body's capacity to manage the stress of surgery has a limit. And a 9, 10, 11-hour operation pushes that limit in ways that a 2-hour procedure does not. Outpatient surgery centers are not designed for 10-hour surgeries. They don't have the blood supplies, the ICU backup, the emergency infrastructure that a hospital does. When something goes wrong 4 hours into a 10-hour procedure at an outpatient center, the options available to the team are fundamentally different from what would be available in a hospital setting. I want to tell you about a case. A woman booked 6 procedures at the same time at an outpatient center in Houston. 6. A body lift, a breast augmentation, a mastopexy, liposuction of multiple areas, fat grafting, and a lipoma excision. The surgery ran for over 10 hours. Within the first hour, she required vasopressors, medications used to raise dangerously low blood pressure. That is a sign that the surgery should have been stopped. Instead, it continued for 9 more hours. After the surgery, she was held in the recovery area for more than 2 hours while bleeding to death. When documentation was examined later, a nurse had recorded the use of 90 lap pads, suggesting blood loss of roughly 2,200 cubic centimeters. The surgeon had recorded 300 cubic centimeters in their operative notes. There was no blood available at the facility for a transfusion. The consent form had mentioned transfusions might be needed, but there was no blood. She died, and her husband filed a wrongful death lawsuit in March of 2026, calling it murder by malpractice. Now, I also want to talk to you about something that I saw happen in the consultation rooms. This is real and it happens all the time. A woman comes in with one area that bothers her. Before you know it, she's booking an 8-hour surgery. She comes in for a consultation, and a salesperson adds two more procedures before she leaves. She's told she's a perfect candidate and encouraged to book that day so that she can get a discount. Before the time's gone and she's gone home to think about it, she books. In a well run practice, a surgeon recommends what is medically appropriate for you, and that's it. If you come in for one thing and the surgeon actually says, yeah, you know what, this is the right procedure for you, or maybe this would be the right procedure for you, that might be a genuine clinical opinion. But you should be going home and thinking about it. You should not be booking it at the same appointment under pressure. If you've ever felt rushed, if you ever feel like the consultation is moving faster than your comfort level, slow down. You don't have to book right now. You can always book later. You can cancel your surgery up to the day before, the minute before. Yes, you will lose your money for sure. If you cancel within that deposit period, within 10 days, read the fine print on your consult, on your paperwork, in your quote, on the consent. There's information for you to read. One of those things is your cancellation policy. And it is very important for you to be familiar with the cancellation policy of your surgeon before you book your deposit down. But if you don't learn it until after you put your deposit down, do not be afraid to walk away from a $500, $1,000, 10%, 30% deposit if you start seeing red flags. It is better to lose your money on the front end, then spend your money in revisions, more surgeries, additional things on the back end. That's my opinion from the experience that I've had and from working with patients for tons of years, tons of women. That's my opinion. Let's talk about the recovery room, the part nobody really talks about. I think this is really important in the whole series, and it's important for women who are planning their surgery. When patients research their procedures, they think about the surgeon, they think about before and afters, they think about the facility and the price. They almost never think about what happens after the surgery is over and the surgeon has walked out of the room. But the post anesthesia care unit, or PACU, is where some of the most devastating outcomes happen in our research. And they occurred after surgeries had gone perfectly. Let me tell you about a case that's still very recent and still in active litigation as I record this episode. A woman, mother of three, nearly 84,000 social media followers, someone who had been publicly documenting her surgery journey for months, underwent a 9-hour procedure at a weight loss focused outpatient surgery center in Ohio. The surgery completed without surgical complication. Her surgeon later said she was talking, awake, and stable after the operation. Then she was transferred to the post anesthesia care unit. Within 5 minutes of arriving, she was given 50 micrograms of fentanyl. 5 minutes after that, 50 more. About 30 minutes later, half a milligram of Dilaudid. According to the lawsuit, that is more opioids in approximately 45 minutes than she had received during her entire 9-hour surgery. There was no anesthesiologist present in the recovery room. When she went unresponsive, the nurse allegedly did not take a proper seal on the bag mask being used to breathe for her. When 911 was called, the nurse reportedly told the dispatcher, "We will be okay until y'all get to us." She suffered an anoxic brain injury, and she died in hospice care 19 days after her surgery. Her surgery went perfect. Her surgeon did everything right. She died in the recovery room. And here's the detail that hits me the hardest about this case. A former anesthesiologist at that facility had submitted written safety concerns about the recovery room in 2020 and 2021. He wrote that he could not be confident that the PACU staff could handle airway problems. He wrote that the facility views limiting costs as primary. Those concerns were not acted on. There's another case I want to mention, and this one is a little different, but it belongs here. An 18-year-old, she saved $6,000 for a breast augmentation. After anesthesia was administered, she went into cardiac arrest. Her surgeon revived her heartbeat, and then instead of calling 911, he called her family. He told them everything was fine, and he refused to allow his staff to call for help for 5 hours. There was a fire station in the same parking lot. The window for treating a brain injury, cooling the brain, and reduce the swelling closes at 6 hours. That window passed while the surgeon was telling her family that everything was fine. She never regained consciousness. She died 14 months later. Her surgeon was eventually convicted of attempted manslaughter. I want you to hear what I'm saying here, and I want you to hear it clearly. The surgery is not the only thing that can go wrong. What happens before the surgery in anesthesia, who is monitoring you, who is staffing the recovery room, whether an anesthesiologist is present, what their emergency protocols are, that matters just as much. And all of these are things that you can find out before you book. Today's red flag of the episode is a question that I want you to walk into every surgical consultation ready to ask. And the question is, what happens if something goes wrong during my procedure? A good surgeon, a surgeon you want to be in a room with, will answer that question completely, calmly, specifically. They tell you all about their emergency protocols. They tell you about their hospital transfer agreements. They'll tell you who is supervising anesthesia and what their recovery room is staffed with. If a surgeon makes you feel silly for asking that question, if they minimize it, if they deflect it, if they say, "Oh, we never have problems," that is a red flag. That is the moment you say, "Thank you very much." You pick up your things and you leave, because any surgeon worth trusting your life with will not only answer that question, they'll respect you for asking it. So now, after everything I walked you through today, I know most of it from my time as a surgery consultant. But there were things I wasn't able to say out loud back then because it wasn't my role to say them. I wasn't in the right place. But it's my place now. And this is the exact place I want to be. If you're planning a BBL or liposuction or a full mommy makeover package, any type of cosmetic procedure, and you want someone who has been on both sides of the table to sit with you and go through your plan, your surgeon, your facility, your recovery setup, that is exactly what I do at Big Butts No Lies. I help you ask the right questions. I help you evaluate the answers. I help you build a plan that puts your safety first, because your safety should always come first. My website is www.bigbuttsnolies.com. Come find me there. Tell me where you are going. What's your plan? And remember, I'm in your corner. Episode 3 is up next, and that one is all about you. What to look for before you book, what to watch for in the consultation room, what to do if something goes wrong. That's the episode that gives you your power back.